And my very final question, I'll direct this just to you, Fiona, if that's okay, because it's directly related to what you do within the charity and the organisation. So one of the really disheartening comments I've had from people when speaking about this topic has been a misunderstanding within the community around people who have dementia. And in particular, I've had one story told to me about their very elderly relative being in a shop. They were acting in a way that caused some questions, and the police came along and dealt with them in a very bad way. They didn't understand that they had dementia. They didn't understand what processes to go through. Now, many police that I've spoken to have been brilliant in that way, but I just wondered on the training side of things, do you think it would make sense to make it a requirement for all people working in the medical professional, people working in the police, to have some sort of dementia-friendly training?
So awareness of dementia is an incredibly important thing, and actually it's linked to the piece around stigma, because one of the reasons that we have, still don't have very high diagnosis rates is because of the stigma surrounding dementia. So the initiatives such as Dementia Friends and dementia friendly communities that we're incredibly proud of at Alzheimer's Society are one way to do this. But specific training for medical and for other kind of public sector workers, I think, is a really good solution. We run a programme called Time for Dementia, and this is a wonderful programme where undergraduate medical and other health professionals such as nurses and pharmacists and physiotherapists in their undergraduate training are buddied with a family who with somebody who has dementia. So right at the heart of their training, they understand the complexities of dementia, what it means to the individual who has that disease, so that as they become more generalists, they in later life, in their career, they will understand a little bit more around that. So I think there's some great initiatives that are already funded by Health Education England that we could look to roll out to other parts of the country and also to other professions.
Thank you. Thank you for all your evidence. Back to you, Chair. Thank you.
Thank you.